Hello, Mrs. Jones. I hear that you are not doing very good today. Please tell me what has been going on.
Hi, doctor. You are right, I've been very stressed. I know I haven't been compliant with my annual exams. I was laid off my previous job and I just got my insurance back. I scheduled this appointment because I have been having chest pain.
I'm sorry to hear that. Please tell me more about your chest pain. Have you been having other symptoms?
Yes, back pain. It actually started as back pain, then it went to my chest.
Any other symptoms with it?
I also noticed a rash.
Okay, and when did all this started?
About 5 days ago.
Have you taken anything for the pain?
Yes. I took Advil but the pain returned. I also tried applying Neosporin on the rash, but that did not work either.
Have you had your shingles immunization before, Mrs. Jones?
I don't think so. I did, however, had my flu shot this year.
I'm glad you took care of that. However, the shingles vaccine is very important. My suspicion is that your symptoms and pain are related to shingles this time.
Oh. And how can I resolve that? The pain is becoming worse every day.
I will prescribe you a medication for your shingles. Its name is acyclovir, and you will take 2 tablets daily for 5 days. In addition, I would like to run some tests to make sure you are still healthy and we don't need to do anything else.
Okay, that's fine.
I will order a CBC, CMP and a liver panel. How are you keeping up with your blood pressure? I have on my notes that you were on lisinopril for your hypertension.
Well, due to all the stress it has been a bit more elevated than usual, but I am still taking my medication as prescribed. I did ran out 3 months ago, but I went to an urgent care and they refilled my medication. I am about to run out of those pretty soon.
I see. I will write you a script for a 15-day supply, but I would like for you to make an appointment with your cardiologist. I want him to check you up more closely on that, especially since you haven't had any cardiac workup in 2 years.
Understood. I will call him tomorrow morning to set up an appointment.
Now please let me examine you. Take a deep breath. Okay. Now let me look at that rash. I see. It looks consistent with shingles. Does it hurt to touch it or is it itchy?
It is not itchy, just painful.
Okay, and it goes from your back to your chest. Have you had any shortness of breath or nausea?
No, doctor. Just this pain.
Okay, just this rash that is presenting as fluid-filled blisters along your right torso. Everything else looks fine. I want to follow up next week. This rash usually lasts 7 to 10 days. I will also like to administer the shingles vaccine today to prevent another episode like this.
Okay, doctor, I appreciate that.
No problem, see you next week.